It's pretty heartbreaking to see when you go to the rural clinics, the huge lines of patients waiting just to receive their medication. Many patients go to the clinic at 8 o'clock in the morning and they don't leave till 2, 3 in the afternoon. Pharmacists sit in the clinic until 6 o'clock in the evening simply to manage the workload.
Daung Hospital in the northwest is a rural hospital in a remote part of the country that must bring health services to people scattered all over their community. They don't have time or money to train more healthcare workers or build more clinics to help more people. But one NGO is exploring a solution with something that reaches 95% of the country: mobile technology.
CLIP started out initially as a research group based as a collaboration between the University of Cape Town and the Cape Peninsula University of Technology, in which they want to research the idea of using mobile technologies as a way to provide health information. Our technology is aimed at streamlining processes, at bridging the infrastructural gaps that exist in many of the clinics and rural areas of South Africa.
Many rural hospitals still have slow manual record-keeping systems that keep pharmacists busy with paperwork when they could be helping patients. But that was before IDAT was developed in 2004.
IDAT started out pretty much as a result of one of our collaborations with the Desmond Tutu HIV Centre, in which one of their head researchers, Professor Robin Wood, came to us and said he's looking for a system, a simple system that will be able to manage stock as well as monitor which drugs are going to which patients and when. So simply to ensure that the correct patients are getting the correct drugs, as well as then the stock control system.
The IDAT process is simple. A patient's information is entered into the computer at Daung Hospital, which sends that information to the CLIP data center in Cape Town. The central computer in Cape Town generates patients' reports and even orders medication when stock levels are low. The IDAT technology gets rid of the time-consuming work of handwritten reports, giving health workers more time with patients.
The IDAT system had made it easier for us to attend to all patients, to actually be able to control our stock level and be able to provide medication for patients at the right time.
We've had reports from some of our pharmacists that they get to go home 2 hours earlier each day simply because they can deal with the patients quicker. And I mean, if a pharmacist is going home 2 hours earlier, that means the patient turnaround time is less and they get to go home quicker. I think one of the key benefits of IDAT is that it's a simple software to use. And it streamlines the whole process, and hence you reducing the number of errors that take place by ensuring that the correct medication goes to the correct patients.
One of the reasons CLIP has been so successful is because it recognized early on that it needed the backing of a leading technology expert like Vodacom. 6 years later, the partnership of NGO and Vodacom has moved research and ideas into development and testing at this pilot project in Daung.
Vodacom Foundation has been there for us since day one. I mean, it was because of them that we managed to go from a research group to becoming a not-for-profit organization. They've been there for us with financial means, they've been there for us from a technical support point of view.
The basic problem in healthcare tends to revolve around the flow of information from doctors to patients and to hospitals. And there have been challenges in managing those kind of relationships. Now with the cell phone, you are able to actually bridge the gap that distances present. And in that way, you are able to convey information in a manner that's usable, real time, and in a manner that makes sense to the parties analyzing that information.
Getting the right information about patients is crucial in the management and treatment of HIV/AIDS. In rural areas, this task falls to home-based carers, who are often the only connection a patient has to the outside world. CLIP adjusted existing cell phone technology to help caregivers record and respond to their patients' concerns.
And Vodacom have helped us in many occasions when it comes to technical aspects, and they helped us to organize a reverse build zero-rated line, pretty much meaning that any of our home-based carers anywhere in the field can report without any money needing to be on their phone. So we didn't need to provide them with credit, and hence literally in any emergency situation they didn't need to worry about whether they had any money to send.
Dawung Hospital and its community are geographically remote, but they are no longer isolated. Because of Cell Life and Vodacom, healthcare for the people of Dawung is now only a cell phone call away.
I really believe the Cell Life project can change lives. One of the key indicators for us is the number of patients that we have on our systems, and to date we have just over 15,000 patients who we're caring for each and every month. The future of our products are ever expanding, and I think with positive feedback from our users we should be able to develop ever more effective tools.